It's 6,000 passengers all locked down after a Chinese couple on board reported feverish symptoms. They finally tested negative for coronavirus. In Hong Kong, they're on the front line of this health crisis. The medics are urgently trying to contain it. But they have more border crossings with mainland China than anywhere else, and they fear a spike in cases is just around the corner. The Hong Kong medical facilities are already under pressure, and the next 2 weeks are going to be critical because of the virus's 14-day incubation period. An estimated 200 to 300,000 people are due back in Hong Kong from mainland China after the New Year lunar celebrations. But this virus can hide itself. This is the city's first coronavirus patient, and he didn't have a fever when he first went to hospital. He was only admitted 2 days later when he returned still unwell and still with no fever.
This time on the X-ray, we found a patch of pneumonia.
And the death toll and the number of confirmed coronavirus cases in China continues to rise by the day. For the latest, we connect to our Kim Jae-hee, who's standing by for us on the line. Jae-hee, please fill us in.
China's National Health Commission said on Friday the number of deaths in China has now reached 213, and around 9,700 cases have been confirmed in the country. That's nearly 2,000 new confirmed cases and 43 more deaths compared to the previous day. Out of the total deaths, 204 deaths came from the Hubei province and 159 were from Wuhan. The rise in the number of cases comes after the World Health Organization declared the coronavirus outbreak a public health emergency of international concern. The Director General for the WHO said on Thursday during a news conference in Geneva that the main reason for the declaration is not because of what is happening in China, but because of what is happening in other countries.
I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus. Our greatest concern is the potential for the virus to spread to countries with weaker health systems and which are ill-prepared to deal with it.
He also stressed that the WHO continues to have confidence in China's capacity to control the outbreak and that there is no need at this time for measures that interfere with travel and trade. The WHO declares international health emergencies for only extraordinary